I am Dr. S. Balalakshman, Associate Professor of Physics. My straight question is commercialization of medical field. So I have learned that the HIV virus gets destroyed automatically when it is kept in air for 30 seconds. When there is saliva or injected into blood, then it grows and it has its effect. Is it true? If that is so, millions of billions of rupees have been spent on the disposable needles, whereas we didn't use disposable syringes and needles in 1970s and 80s. So is it so?
Wait a minute. What does disposable needles have to do with this transmission? I don't understand it.
Will take a caution. That is due to the while transfusion of blood from one person to another person, or when injection is being done by a needle, and with the same needle used for another person, there is a possibility of transmission of HIV, where the person is suffering from.
But look, the problem is not disposable versus reusable needles. The problem is making sure the needle is sterile before you use it. And the reason that disposable needles are used is because of convenience, okay? Because if you use the needle on one patient, you have to make sure you clean it and sterilize it before you can use it on another patient. And that's the virus will survive. You see, the virus will not survive if it's exposed to air. But if you have a contaminated needle, it will be dissolved in the blood that's contaminating the needle. It will not be directly exposed to air. Okay, it will be inside human cells, inside the blood, which is inside the needle. And so you will get transmission. In fact, this is one of the major sources of HIV transmission was through sharing needles during drug abuse. And that's one of the reasons why disposable needles was recommended for that sort of setting. So I don't think they're contradictory. Please. Yes, it'll be destroyed if you sterilize it. It'll be destroyed if you sterilize it. Yes. Okay. That is not a question. Look, the point is, you have to weigh. If you say that you're going to reuse needles, you have to make sure that every single person is following the protocol strictly to sterilize it. Then there's also time. It takes, a few minutes to sterilize, then it has to cool down, then you have to use it. So there's time involved. If there are patients coming one after another, you cannot do that. So this disposable needles is used strictly for convenience, okay? And if it imposes some extra cost, the cost of a needle is nothing compared to the salary of the doctor, the cost of the medicine. All of that is much more than the cost of the needle.